welcome. We're so grateful that you took the time this morning to join us as we all come together to discuss trauma and how it affects college students. We would like to begin by just sharing some brief introductions so that way you can grasp our backgrounds. So first, my name is Dr. Jessica Hallworth, and I am a faculty member in the Special Education Department at Slippery Rock University. I have been teaching there for about 4 years, and I was also a student previously at Slippery Rock. Currently, I advise undergraduate students. Oversee the undergraduate curriculum, and I also am serving as the director of our Rock Life program, which is a post-secondary program for students with disabilities, specifically ID and autism, to come and live the college experience.
Hi, I'm Tony Mild. I am also a professor within the Special Education Department at Slippery Rock University. And this is my 6th year at Slippery Rock. I've had over 15 years total in higher education, and I also have some background in the K-12 setting as a special ed supervisor and as a special education teacher.
Hi, everybody. My name is Ashley Rainier Hershey, and I also teach in the Special Education Department at Slippery Rock University. I also coordinate our doctoral program and work with the students in that program who are looking for an advanced degree. My experience is as a special education teacher in the middle school setting for the most part. I then moved into some different opportunities in higher education. I also have experience working as an administrator in the Pittsburgh area, doing special education director responsibilities, and also working for Pat in Pittsburgh as a consultant related to autism, transition services, and the inclusive practices statewide initiatives.
Hi, I'm Eric. I also work at Slippery Rock, and I'm also a professor. No, this is my starting my 7th year this fall at Slippery Rock, and I've taught at other local Western Pennsylvania universities. And before that, I was a behavioral therapist and educator at two major private institutions, the Watson Institute in Pittsburgh area and the Barber Center in Erie. And I served multiple roles there. And more recently, in my time at Slippery Rock, I also oversee our applied behavior analysis master's degree program. So thank you.
All of us together have had the opportunity to work on trauma specifically and incorporate trauma-informed classrooms and education into our practices within the classroom, which is how all of us derived to this topic today. So during the session, we're going to go over those adverse childhood experiences, what they are, who they are affecting. We're going to look at the background of trauma. What is it? How does it affect student outcomes, especially how it impacts them as college students? We're going to look at some trauma-informed approaches and specific strategies that you can use in your classroom as well as university-wide, as well as some social and emotional learning curriculum that you can incorporate into your classes.
So I'm going to start here with some introductions on some of the terminology and just what is it that we're talking about. So one of the more recent buzzwords to the field here is ACES, Adverse Childhood Experiences. And this refers to events that happen to our students really at any point from their birth up until they come to our campuses. These are significant traumatic experiences that can include anything from abuse to neglect. This can also include environmental stressors, among other things. And the big thing with ACEs is, and the research that we're going to present here is, there's a real persuasive argument now for the neurological changes in our kids' brains, and how something that, God forbid, happened to them as a youngster, as a 2-year-old, a 3-year-old, could still be affecting them as they come onto our campuses. And that's something that is definitely emerging and becoming more and more proven in the research. But the idea with this is sort of a metric for us as support staff, as folks that work with these students, to understand their past and sort of quantify it. So if we say a person's had we'll get into this in a second, but X amount of ACEs, we can expect certain outcomes, or look for trying to inhibit certain outcomes. But ACEs themselves are just that. They're adverse childhood experiences. This can be trauma, neglect, or anything else along those lines that has a negative response to their development and could potentially result in internalizing symptoms psychologically or physically. So in a major study done by the CDC, I apologize for my dog, folks. There was a big study done on ACEs through the Center for Disease Control and Prevention. And this is again, looking at the metrics of how we support this sort of student. How do we start to get to a point where we're on the same playing field? And what this study did was sort of quantify and organize some of the categories of ACEs. And what they looked at was 3 major categories. It was abuse, household challenges, and neglect. And within those different categories, we saw specific circumstances like emotional abuse, physical abuse, or sexual abuse, challenges in terms of negative treatment to to parents, substance abuse, mental health, separations, divorce, breakups of families, incarceration for a household member, and then neglect, physical or emotional neglect. And really what we see with this is a couple things I'd like to point out. One, some of our most common occurrences, and I don't think this is a surprise for anybody who's worked with our youth in the past couple decades, but we know that there is a significant rate of physical abuse that a lot of our students are more likely to experience. We also know that substance abuse is a highly frequently occurring thing, as well as physical abuse. And the other thing with ACEs that the research tells us is these will compound with the idea that these don't happen in isolation, right? A person who was physically abused may also be exposed to divorce, or they may also experience emotional neglect. So the idea with this is we're trying to, as caregivers, as support people, quantify where these students are coming from. But this is where, if we're looking at where our students are largely coming from, these are some of the percentages of what the most common occurring ACEs are for our students. So the prevalence of ACEs, how common are these? And I've had the honor of being in the field almost 20 plus years. So I've sort of knew this was happening before we called them ACEs. And now I'm seeing it in the research, and it's getting some credit that I think it's long overdue. But the prevalence of ACEs is something that for maybe a novice would be, maybe surprising to them. The idea that almost 60%, meaning 6 out of 10 of us, have had at least one of these things happen to us, right? I think that there's been some stigmatizing or some polarization when you say trauma or ACEs, trauma effects or adverse childhood experiences or abuse or neglect. It's a sliding scale, right? And what we see here is the majority of us have at least one, maybe 2 of these. And then as we move forward with these, with 3, 4 or more, that's where the research is starting to tell us that if you get to multiple numbers of these ACEs, you're more and more likely to see psychological results, psychological limitations, physical limitations, involvement in the legal system potentially, and we're going to get into that later. But again, talking about the metrics of how this whole system works, how common are they? Usually, most folks thankfully want 0 to 2 for most of the population, but we do have folks that have multiple. And unfortunately, we have folks that have even 4 or more. But, the research is starting to tell us that once you get to that 4 or more, that's where you're going to really need to consider some type of support or accommodation for those folks as they mature. What are some of these outcomes? Early adversity has lasting impacts, and this is something that that is being proven more and more with every study that comes out over the past couple of years. But these ACEs, this purple circle here, kind of has like a spiral effect. It kind of just affects many different areas. We can see evidences of traumatic brain injury. We can see fractures. We can see physical injuries if a person is physically abused, or they start to internalize this abuse and they start to hurt themselves. We see psychological stressors that are more likely to occur. And then what you start to see is some secondary effects, if you will. You know, if a person is being brought up in an unstable family, or maybe, God forbid, they're a victim of sexual abuse, we're seeing unintended pregnancies, or we're seeing complications or poor maternal health. We're also seeing more increases in the potential for infectious diseases. We're also seeing, more chance for chronic diseases, and the idea that some of these diseases are more or less likely to occur based on your stress levels. So the idea of a person who's predetermined to have diabetes, but their system has been stressed over time because of these ACEs, is more likely to develop that diabetic condition. And we see it even moving forward here. Risky behaviors. This is one of those chicken or egg things. Did it happen because of the risky behavior, or did the risky behavior result because of the poor experience? But we see a lot of our students doing risky behaviors, drugs, alcohol, unsafe sex, poor life choices, doing things that are going to put themselves in unnecessary danger. And as I look through these, and finally we'll get to occupation here in a second, but as I look through these, and in my experience as a college professor, I look at the changes life brings. And anyone who's taught in higher ed will tell you that it's a world of difference from high school. And our kids are presented with a plethora of options when they become a college freshman, when they live on their own. And if you don't have the right sort of background, or, if you have a history of different ACEs that have affected your decision making, a lot of these can happen out of happenstance, which might not have likely happened if you didn't have those past experiences. And for the longest time, that was sort of a theory, but we're proving that now with a lot of the research. So we want to make sure we're supporting these kids. And then finally, the last one here is opportunities. In the university that we work in, we have the honor of working with many first-generation students. So there's a lot of students who will say, I'm the first person in my whole family to make it to college. And sometimes I get flack because I'm working on schoolwork or studying as opposed to trying to find a job and a gainful career. These adverse experiences have a cumulative effect. So if a person who's had many of these negative experiences, the take-home point is they're less likely to pursue, their optimal educational plan, or they might be limited in their occupational explorations only because of the necessity to work through those experiences or process those experiences before moving on to what is quote unquote typical development, finding a job, getting a degree, all those different things. So this is kind of an emerging field we're seeing, but unfortunately, the research is proving some pretty black and white connections between the number of ACEs and the number of these things that could be happening for these students. Last thing I want to talk about here is trauma. And this is another one of those conceptual things I want to present to us, in terms of what are the metrics we're talking about this situation? And trauma is really global examples of ACEs, right? Trauma is a psychological, emotional experience that is deeply distressing or disturbing. And the result is it's upsetting, and it's upsetting in a global sense. It could be something that upsets them physically. There could be physical reactions. There could be psychological reactions. There could be neurological actions. We're going to talk in a minute about some of the effects of trauma. And one of the biggest side effects of trauma we see is short-term memory loss. So think about that as a professor who's teaching these students, a new concept, or, having to be going through a certain steps in a process, and short-term memory loss is an issue for that person. So trauma happens, and the take-home point with trauma is it has that negative effect on a person's system in the global sense. Looking further into trauma, there's different types of trauma here. We have acute trauma, a one time and done. Maybe an example of that could be like a car accident. Obviously, it's scary. Obviously, it's going to get your attention, but eventually, hopefully, you'll be driving a car again. But there's other examples of trauma that are more recurring. Maybe there's an abusive relationship or a neglectful relationship. The other thing to think about with trauma, specifically for our college age kids, is things can happen, right? If there's an incident on campus and that reignites some past experience of a student, that's all things we have to be on top of, and we have to take that. And I like that last bullet there. Um, this encompasses extreme experiences that are severely damaging. So the idea is this is very idiosyncratic. One person who maybe has a quote unquote tougher skin, if we're using that older terminology, might not be affected by one of these ACEs as much as another person. But the idea with trauma is we want to look at it from a very individual point of view, right? And don't generalize. Oh, you guys will be fine. It was just a car accident. Airbags came on. That's not that's not how we think anymore. We have to be very person-centered in supporting them through these instances and processing these instances after the fact.
All right, so I wanted to just touch a little bit on, Eric gave us a really nice overview of the definition of trauma and what trauma is, but looking a little bit more specifically about the statistics behind trauma and how that kind of relates to the ACEs as well. The statistics out there really support the fact that at least 60% of adults report some form of trauma during their childhood. And that could be abuse, a difficult family situation, a divorce in their family. So it's a huge significant part of our population that reports that they have experienced trauma at some point during their childhood. And I think when we look specifically at our own community within the United States, the estimates are as high as 26% of our kids will witness or experience some form of trauma before the age of 4. And I think the piece that's important to talk about related to that is that although it seems like a very young age and that many kids wouldn't remember or internalize what might happen to them or what they might witness at such a young age, in fact, the research really does support that it has quite a significant impact on their life in many ways. That last bullet there just highlights that, young children are exposed to 5 or more young children exposed to 5 or more significant adverse events in those first 3 years of life are at a very significant rate of having the occurrence of issues with brain development. The data saying that at least that it's up to 76% likelihood that those children could have one or more delay in their brain development specific to language and emotion. And I think what we're seeing with young children, we're all special educators in this group, is that this is very recognizable when you're working with young kids. But the idea of thinking of how this impacts students at the college level continues to impact them and has an impact on how we address their needs at the college level as well. The impact of trauma can be very significant, as we've mentioned, and can really have a lot of implications for many areas of a child or an adult's life. And it can affect groups, organizations, communities, individuals. So when we're talking today, we're thinking specifically about a student or a child that might have experienced that and how that impacts their life trajectory and what the statistics behind that looks like. But it really can affect organizations and communities as well as the individuals. It also has a pretty significant impact on every aspect of a child or an adult's life. It can impact their physical health, which then is going to have implications for their success and their growth and their development and their brain development. Simple things as far as not getting access to healthy foods as a young child can really impact the brain development and that child's overall development over many years. So we see that when kids aren't, in more of a neglect kind of situation. It's also going to affect behavioral health. And I think that in this group, we can say that behavioral health has such strong implications for the success of our students at the college level. We often see those kids as young adults in our courses who are struggling throughout the semester with mental health needs. And it really does cause barriers for them as they try to access a future career and be successful at the college level. So trauma really can have very direct implications for behavioral health. ability to learn. It, it causes issues with kids just being able to access a learning environment, not necessarily physically accessing the learning environment, although that can be an issue, but being in a place where they're able to learn mentally, being in a place where they feel safe, where they are fed and, healthy, and allowing them to learn at their optimal ability can be affected as well. And of course, relationships. So we see that individuals who have to handle trauma in their life often have struggles with having healthy relationships. And because of that, as Eric had mentioned, with some of those different areas where we see the ACEs, those adverse childhood experiences, having healthy relationships is extremely critical for children and adults. And if they don't have those healthy relationships, sometimes they also then experience additional ACEs because they make poor choices related to those relationships. And it can just kind of compile the concerns that happen, and more ACEs happen because of some of the previous experiences of trauma that have occurred. So how do we respond to trauma? When we look at responding to trauma and our body's natural inclination to handle that, there's emotional and psychological responses, and then there's also physical responses. Emotionally, we handle things through, some very concrete emotions that we might see with a person: anger, fear, guilt, feeling sadness, hopelessness. We often find that with adults that have experienced trauma throughout their childhood and are, in a college program with us, that sometimes we see that through withdrawal from others, students that feel disconnected and are not able to really build those positive relationships because they're just dealing with the emotional side of that trauma that they've experienced. Physically, individuals who experience trauma, and if you've ever experienced trauma yourself, you'll know that often some of the more physical responses we see are things like fatigue and exhaustion, but not really being able to get to a better place with your sleep because of insomnia or nightmares. Some individuals are startled easily because of the traumatic experience that they've had. Individuals have issues with concentrating, racing heartbeat, and some other things related to just, physical feeling in your body, muscle tension, aches and pains, all of that. And likely individuals who experience trauma are going to experience some of both of these, the emotional and the psychological side, as well as the physical response side of things. So usually there's multiple areas on both of these lists that people who've experienced trauma feel as well. The impact of trauma on education. Trauma can impact school performance. And, as I highlighted in those last couple of slides, because trauma can be so all-encompassing for individuals who've experienced it, it really is a drain on individuals' lives and their livelihood, essentially. It can cause an impact on school performance when we're looking at how these kids are successful or not successful in school. We often see increased rates of dropouts, of suspensions and expulsions. We also see some specific academic deficits as a result of kids who experience trauma as well. Oftentimes, these are students who have lower GPAs. They often have a lower reading ability or decreased reading ability. And the combination of the trauma that they're experiencing and the struggles with handling the emotional side and the physical response side can then usually have some direct effect on kids' performance and success in the school setting. So these are kids who have had a lot of difficulties as they've gone through school. And then when we get these students at the college level, we often continue to see some of these concerns. So although they've maybe been able to keep their head above water through high school, but when they get to the college level, they're going to struggle a little bit more with the independence that also sometimes comes along with the college setting and the college schedule. But I think the big takeaway from this is that understanding the effects of the ACEs, understanding what the ACEs are and how trauma can impact our students in so many different ways is going to give you a better understanding of working with the students at the college level. They really have a lot going on. And I think sometimes it's easy for us as faculty or individuals working with college level students to consider that it might be a lack of interest or a lack of trying, but oftentimes there is just so much more going on with these students, and they've had quite a history of various experiences. And sometimes it's just one or two experiences that can have had such a significant impact on them.
So when we talk about a trauma-informed approach in higher education, we want to focus on our daily practices. We need to have a solid understanding that exposure and over exposure, chronic exposure to trauma does in fact change an individual's sense of self, their beliefs, their relationships. So in terms of our interactions with students, we don't want to increase or trigger any past traumas. We actually need to be cognizant of what can be a trigger. And then once we understand that, obviously not use any of those. While at the same time, we do also want to encourage self-care, whole body wellness in terms of minds and bodies. And this may include maybe implementing mindfulness exercises in class or as an assignment if you're a faculty member. Maybe it's something as simple as you communicating any opportunities across campus of resources that are available, support groups, anything like that. All right, continuing with the trauma-sensitive or trauma-informed campus. Trauma-sensitive campuses will have the philosophy across all departments. So no matter if you're a faculty member, a staff member, if you work in the cafeteria, whatever your role is, students should feel safe. They should feel welcome, and they should also feel supported. It would also be understood that past or present traumas will likely have an impact on that student's learning, like we've already talked about. Trauma-sensitive campuses also have resources. We have procedures in place that can help students affected by trauma. Faculty and staff are aware of these resources. They promote their use. And these resources and procedures are also evaluated on a consistent basis because we need to determine, does something need tweaked a little bit? Do we need to do things a little bit differently? Are students not aware of this? Are they maybe, or our procedure, it's not working? So we definitely want to be looking at it consistently and evaluating it, making sure that everything is as effective as it can be. Another thing with trauma-informed college campuses, we want to make sure that we're implementing trauma into practices, into policies, into our procedures across the entire campus. Faculty and staff should be in service, given the opportunity to partake in professional development opportunities so that they fully understand signs and symptoms of trauma among all stakeholders. And, we talk a lot about students because they're basically why we are, going to work every day, but we also have to look and recognize at all stakeholders. So fellow staff members, fellow faculty members, if we see that, they are experiencing some signs of trauma, we also want to reach out to them and offer services, remind them of resources, that type of thing. Because as we know, trauma's effect, it's widespread. And when we're familiar with the resources available on our campuses and also community-wide, that can only aid in the recovery efforts for anyone that has experienced trauma. This next slide talks about SAMHSA's guiding principles, and SAMHSA is a, if you're not familiar, which I'm sure the majority of you are, if you aren't, it actually is a government agency. It stands for Substance Abuse and Mental Health Services Administration, and they have 6 guiding principles for implementing a trauma-informed school or campus. And again, no matter what your role may be on campus, you can incorporate some of these principles into your daily interactions. So the first one is safety. So how do students, staff, faculty, etc., how do they feel safe in your office, in your classroom? What can you do to accomplish this? The next one is trust. So what are we doing? How are we showing people that we run into on a daily basis that they can actually trust us? In terms of peer support or self-help, how can we promote to go to a peer for assistance or use some self-help skills for someone in need? Because sometimes those outside resources that we may have on campus, they're not open 24/7. So if they're not available, how can someone reach out to a peer? How can they implement things to help themselves, whether it's wellness, mindfulness, or other self-help skills? In terms of collaboration, how are we promoting that? How are we promoting relationships and friendships to be built? Again, how are you doing that in your daily interactions? In terms of empowerment, choice, voice, are you empowering others to make choices, to speak up for themselves? We don't want to always have them be a follower. We want them to kind of step up and actually use their voice as needed. And then the last one, culture, history, gender. So how are you acknowledging? How are you showing acceptance of, support of all cultures, all genders? Do we have any implicit biases that we need to, understand better? So implementing these things within your specific setting can only help your students, your fellow staff members. Next slide actually is just a little activity for you to do. We'll give you about 1 minute. And if you just want to jot down some ideas of ways that you can actually implement these 6 principles. And again, safety, trust, peer support, self-help, collaboration, choice, and culture.
I had one thing I'd like to add with that, Tony, if that's okay. In going through these, I think it makes sense if we're thinking as faculty, if we're faculty members who are listening to this. I just think of my advisement role, right? How are you making your advisement experiences safe, trustworthy, peer support? Are you being collaborative? Are you promoting choice? Are you promoting culture? So another way just to kind of bring those big ideas down is how are you doing this through your advising relationships, right?
Good point. We'll give you about 1 minute just to write down some ideas. And then I have a couple more comments and we'll move on. So bottom line is you came up with some ideas of what you could implement within your setting. And I want to remind you that if you don't currently use any of the principles, those 6 principles, just start small. Pick 2 to 3 and just make a conscious effort to implement some of them as best as you can within your office, within your classroom, within your department. Once you feel comfortable with those, add a couple more. So just keep in mind that doing something is better than nothing. Start small, make it worthwhile.
Now that we have a greater understanding of each of the different areas, it's important that we start to look at some strategies, whether they be classroom specific, even you can think about these a lot of times in your advisement sessions as well, whether you are a advisor to a club on campus, really any part of campus life, you can kind of integrate these strategies. So the first, again, we've talked about some of these, but building that safety and trust. One of the first things that I always do during my first week of teaching when I start a new class is knowing my students' names. This is so important, making sure that I understand, the name that they want to be called by, knowing each of their names, how to say it correctly when I take attendance every day is going to give them that security and feeling of trust and safety in my classroom. And that's the number one um, thing that I want to promote in my class. This is a safe and trusting place. From there, then you can build on everything else. You have that safe space in the classroom. You can be available for questions and concerns, really posting your office hours, being available before or after class so that way students know that, oh, this is the only time I have during your class. Is there a time that I can come in and pop in? I know during the online setting, it kind of made it easier for me to be early and even stay a little bit extra. I didn't have to walk across campus. So it was nice to be able to say, I'm going to be here for an extra 5 minutes after class. And that's something that I think going back into the classroom, I still want to implement and keep in my classes to, give students that opportunity to ask the questions as they need. Also showing how to listen to stories and modeling respectful listening. I've caught myself in the classroom, listening to a story or a student in a situation and I get nervous, like, where is this going? Should I cut it off? I think it's really important that we learn to just listen and then know how to respond back and really make it a teaching moment. Also providing those clear and precise information, via the syllabus and their different assignments, really making sure that we're following all accommodations in the classroom that we need for students who do have disabilities. And lastly, being consistent and reliable in your interactions with students. Trying not to favor specific students, always calling on different students. Sometimes your students who aren't always brave enough to raise their hand really have some incredible things to share. So important that we're engaging all of our students the best we can. A few more when we talk about building trust, asking questions about the class material, making sure that students have time to think and write. So using different strategies like think, pair, share is a great way to encourage that meaning making rather than students just having 30 seconds to think about something and then come up with an answer. If we provide them a little bit more time, they're able to really structure themselves and have a better understanding and grasp. Saying something in front of their peers can be very intimidating. So that's part of that peer support and collaboration that we want to engage our students with. By using small groups and pairing, instead of using whole class discussions, we can really hit on those areas and focus a little bit better and give our students more of a better environment for them. Sometimes it's okay to give limited choices when possible. We have our students and we're always like, give them as many choices as possible. They came to college, they got to pick from how many different schools. But sometimes students, especially students who have gone through trauma, they need to be straightforward. We need to give them one option or a couple options and have them perform on those. As we notice that our students are more comfortable, we can always add in those choices, but sometimes it's okay to be limited and narrow in your focus. Be willing to provide extra explanations and clarifications. Again, in the online setting, some things that I was doing was doing a review for the whole week. So that way students knew all the expectations up front. And I think this is something that going forward could be a really nice thing to add into my classes, especially if a student misses a class because of health concerns or whatever it might be. They can then just hop on to my D2L and know exactly what we were going to be going over for that week and what was needed to be done. And then helping students to view mistakes as opportunities for practice and growth. Again, if they were in a hostile situation before, sometimes when they make a mistake, it's a really big deal. So understanding that it's okay and we can work through these is important for those students. A couple more here. Strength-based activities, reminding students that you care. And again, as Tony had mentioned earlier, really use those other departments on campus and those resources. There's sometimes that I'm still learning about some of the resources that we offer on our campus. And it's important that the departments aren't siloed, but students understand that they can really go anywhere that they need to for student support. So next, we're going to do an activity that has to do with mindfulness. And this is kind of a short entry into meditation, just to be able to provide you with something that you could do to start your classes before you start your content, we learned that if we allow our students to kind of be more grounded and more mindful and really pull themselves together at the beginning of class before just diving right in, they actually can grasp more information moving forward. So this is about a 1-minute video that I'm going to share. I encourage you to relax and settle in and really follow the strategies that are presented.
Just taking a big deep breath in through the nose, out through the mouth. As you breathe in, noticing how the body expands. As you breathe out, just watching the body soften. You gently close the eyes. And rather than the mind leading the breath, allow the breath to lead the mind. Notice the sensation of the breath. Notice it where you feel it in the body. If you need to, you can just gently place your hand on the stomach. And just following that rising and falling sensation. Nothing else to do. Allowing thoughts to come and go. And when you're ready, just gently opening the eyes again.
So now I want you to reflect. After you completed the mindfulness activity, how did it make you feel? Were you more relaxed? Do you feel more engaged with your surroundings? How can this impact your students in your future classes? Or maybe you're an advisor. Whatever it might be, how can this impact students? One thing that I think is important is sometimes we have to teach students how to use self-care. Especially now, I think it's such a buzzword that students don't always know what self-care really means. So sometimes helping them find really important parts. And just thinking about, would you ever consider incorporating this type of social emotional learning component into your classes to support your own students? And I'm curious, in the chat, why don't we have a small conversation? If you have already done this, did you see an overall impact in your classes? Up today. We really want colleges to work with students who have experienced trauma, but faculty and staff may not always have these students or know who these students are. So colleges and universities, we have a really important role to play in providing stability, a safe environment and a safe campus for students, connecting students with mental health supports and services, and creating a learning environment that is attuned to the educational needs of students that may be living with a trauma narrative. So often, as we've said before, we forget that our students may come in with these trauma, or they come in with ACEs. We just expect them to be in a perfect little box with a bow on them. And this isn't the case. So it's really important that we are able to provide these supports and think that our students are not perfect and we might have to support them in more ways than we anticipated. So if we do move towards more of a trauma-informed campus and in our classrooms and at the college and university level, we can develop and implement those strategies and programs that are going to be more effective and meet the needs of our students for when they leave us. Because remember, we have a short time with them in college, and we're now preparing them for that big step of working in whatever field they move towards. We have provided our references in case you would like to check anything out to support your own classroom. And then we just want to thank everyone for their time. We are going to be available now for questions, comments, and conversation related to this topic.